Hi, good morning. My name is Ronald Boyle, and I've been a patient at the Mayo Clinic. I had a pulmonary vein ablation approximately 3 months ago. I'm here for a follow-up visit, and if I could sum up my experience at Mayo Clinic, it has been just from beginning to end more than I could have hoped for. It has really almost, I could say, changed my life. I had atrial fibrillation for about 12 years. I was on medication and things went progressing stably, starting to go downhill, and luckily I was able to make contact with people at Mayo and got involved in a voluntary program for testing out a new type of catheter under the direction of Dr. Douglas Packer. And that's how I came to be a patient at the Mayo Clinic. Everybody that I had contact with at Mayo, bar none, it has been a very positive experience. You just can't, I guess, overemphasize the fact that it seems like you're dealing with an organization that is just above and beyond. The way that they treat the patients, the capabilities of the people that you deal with, and in my particular case, the results have just been, as I said before, more than I could have expected. It doesn't happen to everybody. I guess I'm one of the fortunate ones, but I tell you that even if it didn't turn out right, I wouldn't have any regrets about coming to the Mayo Clinic. My first exposure to atrial fibrillation, it was really almost, it didn't really affect my life because I was only in atrial fibrillation for very short periods of time. But over the years it developed that I was in A-Fib for longer and longer periods. And the medications that I was on either had to be increased, and sometimes that didn't help out. And near the end, it was really on a downward path. Things just weren't improving with changes in the medication, and I was in atrial fibrillation almost on a continuing basis. And that's when I started to look around to see if there might be some other ways besides the medications that might be helpful to me. And I was aware of the pulmonary vein ablation procedures, having visited many websites, including afib.com. And with that, I searched the web and luckily found that there was a study being performed at the Mayo Clinic that might be helpful to me. And I contacted the people, and they were, well, that was the beginning, and they were very helpful. They were very positive, they were very professional, they didn't lead me on, they let me know what the possibilities were, good and bad, that the procedure could have many problematic side effects, but all in all, they just got me prepared, and it looked to me like the way to go, and it certainly turned out that way. Before the procedure, when I was in A-Fib most of the time, getting upstairs was a problem, just doing daily routine was a problem. Get up in the morning and be totally fatigued, and and that's the way the day would start, but that's all gone, that's in the past now. And I have family in Alaska, and there's a lot of things to do in Alaska, but I couldn't do them the last time I was up there because of the A-Fib, and now I'm looking for a very nice change and a nice experience up there.